Hello everyone, my name is Filipina Santos and today I'm going to do a presentation that revolves around health policy and law. So my presentation will cover three critical areas of discussion. First, I'm going to discuss the role of health policy and law in today's society. Second, I'm going to discuss some of the problems or issues with health policy and law. And finally, I'm going to discuss why policy making is needed in today's society. So let's get started. Before we go any further in our discussion about health policy and law, I think it's vital that we understand or we know the difference between policy and law. So, according to Joel Teitelbaum and Sarah Walensky, policy is defined as authoritative decision made in the legislative, executive, or judicial branches of the government that are intended to direct or influence the actions, behavior, and decisions of others. So, to put it simply, a policy is a plan of action that impacts our lives. So, it outlines what an organization hopes to achieve and everything that they have to do to achieve it. So, law, on the other hand, is defined simply as legal system. So, it is the system of standards, procedures, and rules that we must abide by. So, as you can see on the definitions, they may appear somewhat similar, but they are very, very, very different. So, now that we know the difference between policy and law, let's now discuss its role in our society. So, Joel Teitelbaum and Sarah Walensky, author of the book Essential of Health Policy and Law, identified the three broad topical domains of health policy and law. In the light of our topic for today, I'm only going to discuss two of the domains, which are the health policy and law and public health policy and law. I really believe that understanding these two critical domains will give us a concrete understanding of the role of health policy and law in our society. So the first domain that we're going to discuss is the health policy and law. Health policy and law is a domain that revolves around an individual access of care, quality of care, and how care is going to be financed. So the Office of Disease Prevention and Health Promotion explained the three components required for an individual to access healthcare services. These are coverage, services, and timelines. These three components actually comes with policies and law that can impact access of care. For instance, health insurance. So health insurance is critical for an individual to gain entry into the healthcare system. So health insurance comprises with different policies. Medicare and Medicaid, for example, are both health insurance programs that are administered by the government. Although both run by the government, they serve two different groups. For instance, the Center for Medicaid and Medicare Services, like the CMS, outlines the policies under the Medicare program, its different parts and coverage or specific services, as well as the general information regarding qualification. So as you can see, healthcare policy and law play a critical role on individual access to healthcare services. So the second domain is the public health policy and law. So health policy and law also play a role in the health of the general public. Public health policy and law central focus, according to Joel Teitelbaum and Sarah Walensky, author of the book Essential of Health Policy and Law, is why and how the government regulates individual and corporation in the name of protecting health, safety, and welfare of the general public. So, for example, there's this research done by Mary Martinezek and her team of Public Health Department of Health Sciences in the University of Tampa. It shows that water pipe tobacco smoking has a great impact on public health because of its negative effects. So the Clean Indoor Air Act is the legislation that handles this kind of regulations, like the policy, the exceptions regarding this type of tobacco. But Marty Martinezek and her team argues that there's a lot of loopholes within the policy that greatly affects some states in the city. So the point that I was trying to make in this research study is that this is how public policy and law affects us. So this is how it affects the society. They create policies and pass law that they believe is the best interest of the public. So Same thing, public health are also in charge of promoting health and lifestyle, detecting, researching, preventing, and responding to infectious disease. So this is how public health policy and law affects society. So now we know the role of health policy and law in today's society. Let's now discuss some of the problems and issues with policy and law. So we know the health policy and law may cover areas such as access of care, quality of care, and financing or delivery. Um, I really see a problem or issues in the area of financing, particularly out of control drug pricing and high out of pocket costs. So, drug prices are skyrocketing. We all know that. I mean, as a consumer that uses a prescription medication daily, I know firsthand the effects of high cost of prescription. So I see this as a problem that health policy and law should actually regulate. Same thing as the high out-of-pocket costs. So there's the study that was done by Kathy Cohen and Karen Davis and Amber Willink of the Commonwealth Fund. It shows that more than one-fourth of all Medicare beneficiaries, 15 million people, spend 20% or more of their incomes or premium plus Medicare, including cost sharing and uncovered services. So technically having an insurance coverage does not even protect individuals from out-of-pocket costs. So I really see this as a problem. This is becoming a burden, especially for low-income families. This is definitely a problem, and health policy and law must intervene to regulate the skyrocketing costs. So now that we know, or now that we are aware of some of the issues of health policy and law, we are now going to move on to our final area of my presentation, which is why policy is needed. Um, so why policy making is needed. Sorry. So, like as you can see it, the problem and issues about health policy and law that we just discussed is the very reason why policy making is needed in our society. So policy, like we discussed, is a critical component of an organization. Policies address pertinent issues that constitute what is acceptable and what is not. I mean, it is a policy that guides an organization, government or non-government, to achieve its objectives and accomplish its goals. So today, we discussed the role of health policy in law in today's society by discussing its role in an individual access of care and its role in protecting the health of the entire populations. We also discussed the problems and issues of health policy, particularly in the areas of financing, where high out-of-pocket cost and out-of-control drug pricing is an issue. And finally, we discussed the importance of policy making, as it is the policy that guides an organization, government or non-government, to achieve its objective and accomplish its goals. So there you have it. Thank you guys so much for watching. Yeah, thank you.